Good morning. Hello, everybody. How are you? So I hope I'm live today because today is Thursday. Yesterday, I meant to go live and all I did was record it in my Zoom. I forgot to hit go live in the Facebook group, so I just had to post it without going live. So anyway, good morning. Hi, how are you? I am continuing the story of why your anti-inflammatory treatments aren't working for your knee pain or your back pain or your shoulder pain or your neck pain. It's all the same reasons. So today I am continuing the story about Melissa. We talked about Melissa having long-standing knee pain before she met me. And so one thing that Melissa did not do, and most people don't do, is not strengthening your muscles during a pain-free season of life. So one reason that Melissa and other people need to keep going back for those cortisone injections is because they don't take advantage of the time period where they have pain-free motion. And what do I mean by that? So I mean that if you have periods of time where your knee or your other body part doesn't hurt, you should be strengthening those muscles in that area. You should also be stretching your muscles. But really, I'm going to be focusing on strengthening because as a whole, I think we do too much stretching, and that can go in one direction of not being enough for us. So one thing that Melissa didn't do, and really she didn't know to do it, was that when she was getting these cortisone injections, she wasn't taking advantage of that pain-free period of time that she had afterward to go and strengthen her legs. She didn't strengthen her core. She didn't strengthen her hips, her knees, and her ankles, the muscles that are attaching to all of those joints. So when I lived in Rhode Island and I worked closely with the pain management physician for the Comprehensive Spine Center of Rhode Island Hospital, he would do injections or other procedures, mainly injections, and then he'd send the patients to me for physical therapy. We coordinated the physical therapy to match up with the injections, typically starting the day after an injection. Now, some physicians will say, nope, you got to wait 48 hours before you exercise. Yep, I agree with that. But if you start physical therapy the day after you get the cortisone injection, you can learn some gentle movements that you can do that the doctors don't actually consider exercise. So like bending and straightening your knee, just, keeping it loose and limber when you're sitting in a chair, when you're laying in bed, doing a few, like what position should you just let your leg rest in? And so you can start those day of or day after the injection. I recommend day after. And so we would coordinate that time. And my patients would always ask me, well, I don't get it. Like, I'm getting the cortisone injection for pain relief. So why do I need to be here? And I said, well, the cortisone, wait, let me back up. I would talk about how what got them in this scenario, in this situation, was likely that the muscles were weak or the muscles weren't flexible. But once they got to the point where they were at, it was too painful to strengthen, to do exercise, to stretch, to frankly do anything. So getting the cortisone injection allows them the pain-free time period to now do the strengthening exercises, do some movement exercises, do some stretching. And like I said, I'm going to be mainly talking about strengthening because as a whole, I think we overstretch. We don't strengthen enough. We need to find a happy balance. So by strengthening the muscles, you're going to better support your knee joint so that you don't create friction, so that you aren't rubbing on the different areas of your knee. And if you have knee pain, knee problems, maybe you have a torn meniscus, maybe you have arthritis, maybe you have tendinitis, well, those things happen over time. With the exception of a torn meniscus, there are instances where it's a one-time movement that creates it. But other times it's an overuse, a degeneration, a wear and tear of the cartilage, of the meniscus, pulling and pushing too much on the tendon for what it can take. And so you get the cortisone injection. And now if you can strengthen the muscles of your hips, of your thigh muscles, of your calf muscles, now you have all of these muscles that are surrounding your knee joint to do their job. They're there to support the body. The joints themselves are there to allow our body to move, but without the muscles, we couldn't actually move. We'd just be a skeleton. And skeletons don't move. They just fall apart because they have nothing holding them together besides the ligaments, the tendons, and the muscles, right? So if we get the cortisone injection and then we do nothing, and we're just like, oh, great, this is awesome. I don't have any pain. I can go about my business. I can go to the grocery store without any pain. I can walk down the street without any pain. Yes, that's all well and good, but 3 months down the line or sooner, you're going to wind up in the same place because what got you here won't get you there. What got you to this point of pain will definitely not keep you pain-free. If you do the same old thing, you're going to get the same old result. So by getting the cortisone injection, that's great. Let's get some pain relief. And then let's strengthen the muscles around that joint, or really in the whole leg, the whole body, to help support the body better so that you don't create any more wear and tear, and you're less likely to create more pain down the line. So I do recommend cortisone injections if you can't do anything, but they're not going to last forever. And you have to take advantage of that time period where you don't have the pain to be able to do some controlled exercises. I don't mean go and do box jumps and burpees and all sorts of crazy things. I actually don't even recommend those things at all. I don't like doing them myself. I think the cons outweigh the pros. But doing controlled exercises, laying down strength exercises, standing, walking exercises with elastic bands and dumbbells and things like that, things that can be in a controlled manner to strengthen your muscles, to better support your body, to prevent the pain from coming back. Because now you're preventing that friction that's creating some of that localized inflammation. Now, remember, if a cortisone injection is working, it's because the inflammation is localized to the knee or whatever body part you get that injection into. And so if you can strengthen the muscles around it, you're going to decrease the chances of getting inflammation and pain there again. So if you want your cortisone injection to last longer, do some strength exercises. If you're not sure what to do, reach out to me, because I've made video upon video of different exercises to do that are safe to do with arthritis, that are safe to do with pain, to build it up there. So that is everything for today. Thank you guys so much. As always, comment below if you have a question that you want answered in videos like this, or if it's more specific to your needs, we can hop on a call and talk about what you can do as your next steps. All right, have a great rest of your day. I will see you guys soon.